Hello everyone, welcome back to the Anatomy Lab. Today we're going to be continuing our Advanced Anatomy series for the physical therapy students, which will include a description of the cadaveric dissection. But just to be clear for this one in particular, it's mostly going to be describing the dissection only. But I will include a few things that you will only see through the dissection, but if you do want to talk about the overview of the structures, then please take a look at the videos for the nerves and the blood vessels and even the muscles of the arm, which I have separately. So to get started, we have turned over the body so we can see the supine anterior view. And in this case, we're going to be continuing the shoulder, but also going into the chest, the axilla, and the anterior arm region. So we haven't done a lot of dissection of the anterior side yet. We may have gone a little bit across the shoulder, but for the most part, nothing has been touched too much. So the first thing that we're going to actually need to do is, as usual, take off the skin. So what we're going to do is take off the skin from one side of the body, starting to go down the front of the sternum, going along the shoulder, and then if possible, we can connect it to our other cut that we had before. But just to be clear, we have some superficial structures to be especially careful of. So to name our first one actually it's going to be a very superficial vein that is very easily cut sometimes. So we need to be very careful of it. And where you're going to find that is right here between the deltoid and the pectoralis major. So as we're taking off the skin from going from either medial or lateral side, we just need to be very careful of a vein that's going to be on the lateral side of the arm, but also traveling right here between the deltoid and the pectoralis major. So this vein is going to connect to the axillary vein, which is a little bit deep, but this is exactly where we find it. So if we can find it here in particular, we can follow it and go down and look for it along its path. And by finding it and locating it first, we will be very effective in not cutting it. So that is the important part. We want to find it and then follow it so that we know exactly where it is to prevent us from, cutting it. Now, once we have taken off more of the skin, though, we will see the superficial chest muscles, like the pectoralis major, which will be covering the pectoralis minor. And what that means is we need to, once again, reflect it to see underneath. So as usual, number 1, find the muscle. Number 2, find the borders. Number 3, separate it from everything else that we possibly can. So that means going under the pectoralis major, because you can see that it's attached to the ribs, as well as the sternum and the clavicle. This is going to be the most open area to do so. But once we have cut it or found the inferior border, we can basically cut it along here and then along the medial side from the sternum to start reflecting it. And then ultimately also cut it from the bottom of the clavicle as well, so that we can fully reflect it and find everything underneath, including the pectoralis minor and everything down here in the armpit or the axilla. So as we reflect the pectoralis major though, that's where we're going to look for a few specific things, especially a couple of nerves, which will be the medial and lateral pectoral nerves. So the lateral pectoral nerve we should find going kind of near the top of the pectoralis major, but we should also look for a very kind of small nerve that can travel through the pectoralis minor into the lower fibers of the pectoralis major as well. So as we reflect, we will look for those two nerves either going through pectoralis minor or above it. But eventually we will need to cut them because otherwise we cannot fully reflect the pectoralis major. But if we can, we want to find them and keep as much of it as possible. So we will find them and then cut them so that we can hopefully keep a large piece either attached to the chest or to the pectoralis major. Now, once we have fully reflected the pectoralis major, then we'll have a generally completely open axilla to work with. And if you remember regarding the axillary fascia, we're going to have a lot of tissue in here, a lot of fat for the most part. So this is where we're going to be looking for quite a few blood vessels and nerves. I mean, arteries, veins, nerves, everything will be here. And you can see quite a few of them. And I guess just to name a few, you'll see nerves such as the musculocutaneous nerve, the median nerve, the ulnar nerve, and then behind them you'll also find the radial nerve, the one that we found on the back of the arm but starting up here in the front, as well as the radial or the axillary nerve that's going to be going underneath here and around the armpit, under the armpit, and then around the humerus. So axillary nerve and radial nerve will be in the back, either going under the armpit to the back of the humerus or down and spiraling around the back of the humerus between the heads of the triceps brachii. Now, a few more superficial things that I would probably look for are, once again, more veins. So we'll follow that cephalic vein as best we can, but we're also going to see it connecting to some veins down here. So just to be clear, the cephalic vein goes all the way from the hand, up the arm, up the shoulder, and all the way to where we found it between the deltoid and pectoralis major. But we'll also see that there's another superficial vein, but on the medial side. That is going to be called the basilic vein, which will start down here and then go up the medial side, but it actually travels a little bit deeper along the arm region. But you want to be very careful of it in the superficial antebrachial region, which is where you will find it connecting to the cephalic vein across a vein called the median cubital vein. And that's something that we'll, once again, hopefully be able to find if we're very careful. But this is where we need to be especially careful as well, because this vein is very, very superficial and easy to cut. And then for the most part, I would say most of the things are relatively out of danger, with a couple of exceptions, which are not shown here, but you will have cutaneous nerves coming from the medial side of the arm and forearm, or going along the medial side of the arm and forearm, as well as a cutaneous nerve coming out of the lateral arm as well. But these are a little bit safer for the most part. But I guess with that said, everything else will be described at a later time or in another video. But if we can, I'll try to emphasize a few more things later. But for now, thank you for listening. Good luck with your studying, and I'll see you all next time.